neuroplasticity and home exercise programs, and we'll talk about Motus Nova and how we are changing some of those approaches. So we'll look at overview of neuroplasticity, discussing then what Motus Nova is and how we're going about different things, looking at our two devices, the Motus Hand and Motus Foot, and then we'll kind of go from there. So first, neuroplasticity. Okay, so in general, neuroplasticity is talking about the ability of the brain to change, reorganize itself both in structure and how it functions. Okay, so neuroplasticity is neurogenesis, so continuous new generation of neurons in a part of the brain. Okay, that obviously when we have new neurons, those need to make new connections. Okay, so new skills and experiences create those new connections. Okay, those connections and synapses, they call them, they're strengthened by repetition and practice. So kind of the big process. The things that are weakened are the things that we aren't working on. Okay, so connections in the brain that aren't being used become weak. So if we think of neuroplasticity as a whole, with stroke recovery, we can think about any part of that part of an individual's function or their ability of what their brain is to do that has changed and is requiring, recovery or continued reorganization for new tasks, new experiences, new emotions. If we think of neuroplasticity, it's not just for people in neuro recovery, but everybody can change the way that their brain is working by practicing or learning something new, and going through a process of kind of these next couple slides. So if we think about anybody that is trying to learn something new, it's changing their brain and how it works in order to learn and get better at whatever those skills might be. Reading faster, learning new things, playing the piano, golfing, driving in a race car, all of these being practices of new things for a lot of people that require the changes in the brain. Okay, so there's a bunch of concepts we'll go through and things to emphasize and highlight what neuroplasticity does, but also how we can promote best ability to change what the brain's doing with that neuroplasticity. So first one is use it or lose it. When we don't practice something for an extended period of time, those pathways start to weaken, and of course they get weaker over time. So we need to use the things in order for them to maintain, and we need to continue to use whatever that might be for continued amount of time, a lot of repetitions going forward. Okay, so second one is use it and improve it. Of course, if we practice something a lot, that's when those connections get better. Okay, so if you're trying to play tennis, trying to golf, we need to practice a lot in order for us to get better. If we have had a stroke and all of a sudden our vision's not working well to one area, or our brain isn't quite remembering things as well, or our hand isn't quite opening and closing as well, we need to use those things in order for them to do better. Okay. So this next one is salience. Now, salience has to do with how we feel when we're trying to make these changes, okay? So when we think about our brain being affected by any kind of injury, there can be parts of the brain that are affected that control our emotions and control our motivations and can control generally how we feel about life. And how we feel about moving and pushing forward against kind of everything that's that we're dealing with. Okay, so salience is tying an emotion to a task or working towards certain things that we're trying to remember. If we feel with that act or that emotion, we are going to make a larger memory around that. Okay, We talked a little bit about repetition, okay? It's certainly required for long-term changes, okay? We need a lot of repetition. We need a lot of practice in order for those things to become the new normal, but also to promote that change. And then it needs to be at a proper intensity, okay? So we need to do things that are challenging for us in order to improve. All right. If we just do the same thing again and again, well, then our brain gets used to doing that one thing and it's not going to improve upon what we're doing. So continuing to push what we're able to do. Last few things on this slide, of course. Some specifics. We're looking at specificity, learning something new helps old skills increase connections to the brain. So if we have something that, like we have mentioned, if we have something we get really good at, it's easy for us to add a little bit more and then create that new part as something that's kind of the new normal. But also, if we have something that we used to do, it's going to be easier for us to get back into that new or that old task and get better at it. Okay. Age is the next one. So brains can grow and change at any age. All right. So there's a lot of research, especially in the last 10, 15 years, about how long it takes or how long after a neurological event, for instance, a stroke, how long a patient has to make progress. Okay, so there's certainly windows of time that patients will recover quicker. Okay, which comes because the brain's healing, but also we can have a lot of these other factors that are working well for us. But the research is telling us that even after 10, 12 years after a stroke, we're able to promote neuroplasticity if we are targeting those areas and kind of using all of these concepts of neuroplasticity combined. So time, like I had mentioned, is, well, I guess that loops into what I was just talking about. Got ahead of myself. So change can happen anytime if therapy is changing, increasing, and strengthening the pathways in your brain. Okay. If we want to make change and we are supporting that change, getting the repetitions, then we're able to make change. Transference is learning in one location, for instance, in the therapy office. Okay, we're learning tasks there. Then they're able to generalize over to your home setting. Okay, that's the whole idea of learning something in the office or in the clinic, and then being able to bring it back to the home setting. Okay. Lastly, we have interference. So if we are learning something that is different or incorrect, then it's going to interfere with doing things the correct way. Okay. Certainly, if we're just doing something, that's always a good thing. If we're doing something and doing it incorrectly, that can interfere, of course, with it going the correct way. So how does neuroplasticity what does that have to do with home exercise programs? Of course, when we go and we have therapy, okay, we are going 1 to 2 times a week, or sometimes every other week. It certainly depends on where we are with recovery and how well we're doing. But what neuroscience tells us is that we need to continue to work on those tasks, whether it be trying to say words, whether it's sit to stand, leg exercises, whether it's specific reading or following with our eyes, all of these being areas that stroke patients may need to recover in. So it's really important for us to do this at home as well. So a couple questions for us to reflect on, and you guys can just shout out if you'd like. But how many of you have had a home exercise program? I mean,
I've implemented by doing my physical therapy at a place. Okay, and I
yep.
take it, whatever they give me, I bring it at home.
Yep.
Home.
That's exactly right. So most home exercise programs for people that have had a stroke are going to come from those therapists that you see. And most therapists are going to provide that home exercise program to continue what you have been learning and working on in the clinic, in your therapy sessions, to then work on at home. which is
Yes.
exactly right. So most everybody that's gone to therapy has had some kind of home exercise program. So then the next question is, how many of you do that home exercise program daily or to the recommendation of your therapist? And this one can be a tough one because
Yeah. Mm-hmm.
there's a lot of different variables that go into that, right?
Right. Mm-hmm.
Well,
I try.
it,
I try to do it daily, but I don't do it as much as I should. But I do
Yeah,
try to
yeah.
do it daily. Uh-huh. Mm-hmm.
there's a lot of exercises in our individual programs, and over the course of months or several of us years, we may forget or not accurately um, perform those because
Mm-hmm.
our memory of how to do those exercises or that program have slipped with
Mm-hmm.
time.
Yeah, and it
Yeah.
certainly happens, right? So there's, the idea is there's a lot of variables and a lot of difficulties that go into a home exercise program. Certainly there are people that can do everything, as they're, intended to and as they're taught to, but there's a lot of variables that go into that. As you mentioned, we might forget certain things, or it might have been a little while between our therapy appointments, and to adjust some of those things might be more difficult. And then it could be that we can't get in for another appointment to adjust whatever exercises. Perhaps we're doing better than we thought we were, or perhaps what we thought we could do, we couldn't quite do at home because, doing it in the clinic, we were able to do it with our therapist, but perhaps, whoever you have at home might not be able to assist as well. So there's all sorts of different things that go into that accuracy, but also that consistency with keeping up with a home exercise program.
Yeah.
All right. So what happens too is a lot of these things take time, right? Like you had mentioned, we have kind of a months to years type of approach to home exercise program. If we think about anybody that wants to make change in their life, if they want to promote neuroplasticity, you can think right away to January 1st. Everybody's got a new exercise that they want to be working towards. Everybody goes to the gym, and what happens is 4 weeks later, all of a sudden, nobody's going to the gym anymore. Okay, so it takes a lot of consistency and repetition, but it takes time for people to make change. Okay, it takes time for people that haven't had a stroke to do any kind of change because it's different from what our normal everyday routine is. We're needing to promote change, which means we have to have all these other things going in the right direction too. So changes take time. Okay, so general research says that 30% of patients are compliant with their home exercise programs. Okay, and that's overall, not necessarily people that that's not everybody, but of course, in general for therapy, that's a 30% compliance rate. Okay. What happens, of course, is when patients return home and they are going to outpatient therapy, they're getting, 1 to 2 visits a week. That might be OT and PT, and then obviously with speech as well. Okay, so we could be looking at 2 to 3 hours a week of therapy. Okay, sometimes a little bit more. When we're looking at promoting neuroplasticity, we need 15 plus hours a week of that focused home exercise, and that focused neuro movement and activity. Okay, in order to promote that neuroplasticity. So it really puts a big emphasis on doing a lot of movement and activity at home. Okay, whether that's retraining our brain, retraining our body, retraining our eyes, all of these different things that people that have had a stroke go through. It takes a lot of work to recover some of those skills. Let's see. So, of course, we look at home exercise programs, right? and we look at what we can do at home, okay, especially for specific stroke patients. Now, what Motus Nova is that we have two devices. There's the Motus Hand and the Motus Foot. I'll show you what these are once I stop sharing here in a couple minutes, but these are both FDA Class 1 approved medical devices. They are essentially robotic exoskeletons, okay? They have a pneumatic pump that's in the system that is able to talk to the computer and the screen and is able to provide active assist movement for a patient, okay? So they have been part of 24 peer-reviewed clinical research studies. Those were done at a bunch of various places, Cleveland Clinic, Emory University, a bunch of VA clinics. And all of those, that initial research was done with patients with stroke recovery. So the basis around the research was with repetitive task practice, okay? So continuing to do a specific task again and again and again, okay? And then constraint-induced movement therapy, okay? So if we're thinking about forced use of an extremity through a range of motion, that's the idea around constraint-induced movement therapy. So those two approaches being kind of the best approaches when it comes to therapy approaches with recovering movement and activity of an upper or lower extremity. Okay, so some of those studies we looked at, of course, with the Motus Hand, we are showing improvements with active range of motion and passive range of motion, also reduction in tone, increased fine and gross motor movements, so pinch strength, grip strength of the hand. With the foot, we're showing increased, the foot focuses on the ankle plantar flexion and dorsiflexion, showing increased outcomes with standing balance, sit to stand speed, gait speed, walking endurance, okay? If somebody has an AFO, we're targeting that foot movement in order to get rid of that AFO or walk more independently. All right, so all of the initial research was done on patients with in their stroke recovery, but since then, Motus Nova has put out over 5,000 of these devices to patients in all 50 states, all since in the last 5 years. So those were not only with stroke patients, but all their other patients and neurological populations, such as traumatic brain injury, multiple sclerosis, spinal cord injury, Parkinson's patients, cerebral palsy, peripheral nerve injuries. Now that basically means a stroke comes from the brain where there's damage in the brain and it affects the ability of the body to perform different activities. A peripheral nerve injury is when the nerve from anywhere going outside of the brain is damaged. So if we have a spinal cord injury, that's where the nerve is injured in the spine. If somebody has a hip surgery, they might, there are occasions where they come out and they have drop foot, and that essentially means that the nerve was damaged at some point along the way with changing out that hip. And so a lot of times those patients require a lot of focused therapy in order to recover that mobility. So basically anybody that can benefit from repetitive task practice. So continuing those repetitions of movement again and again. Okay. So what I want to do is we'll look at a few things. Yeah, let's look at this one. So if we think about the general population of patients that work with home exercise programs at 30% compliance rate, what Motus Nova is showing is a 70% adherence rate to regular home exercise program use with our Motus Hand or Motus Foot, okay? There's a lot of things that go into that, okay? system is set up to provide a just right challenge. Okay, so I'll show you in a couple minutes how everything works, but the assistance provided through a range of motion detects 1/10 of a degree of motion in that hand or that foot, and the system is able to detect that movement and then adjust how much it's assisting in order to provide that just right challenge. So if we think about at therapy, a therapist is able to move a hand or a foot to assist and take away some of that resistance. That's the same idea with the Motus hand and Motus foot. Okay, this is connected to the screen, as you can see this woman here with the Motus hand kind of in her lap there. She's got the screen on a little table. It is connected to the screen, and the screen is interacting with what her movements are. Okay, so if she's moving that wrist down, then it's going to control the movement going down on the screen, and then it's you are going through and controlling different games and activities, and it provides a lot of biofeedback. Okay, if we're focused on the screen and we're getting assistance with the hand movements, then the part of the brain that's lighting up, okay, is working and creating that neuroplasticity with that biofeedback. Okay, when somebody gets this at home, we don't just send it out to them and say good luck. We are following up with a recovery coach that is paired with the patient. Okay, the patient receives this at home. The recovery coach is going to call them via phone or video, and they are able to connect with them and essentially customize the experience of the screen and the games and the device for them. Okay, so there's 25 different games and activities that people can choose from. They all have different kind of purposes and different goals, whether it's gross motor, big movements, fine motor, smaller movements, things like endurance or just continued work with different goals. Okay, so
Matt, I have a
recovery
question.
coaches are setting up long-term goals with the patient, and then they are able to check in every 2 to 3 weeks and
Matt?
update. Yep,
I have a question.
sure, go ahead.
She looks like she's got a speaker adjusted to her face.
I'm curious what that is too, and I wonder, I don't know what it is, but it doesn't have anything to do with what she's doing.
Okay, we'll disregard it.
Yeah, it's a good question. I was looking at that too, and I was curious. I initially thought it was like her sweatshirt string, but she's not wearing a sweatshirt. But yes, so nothing to do with the microphone or
Maybe-
attachment to the mouth or face. It's
Maybe
more or less.
she's a-
And
maybe she's in a
I'll show you
wheelchair
in a minute here, but
Maybe
it's that
she's in a
hand.
wheelchair that's controlled by her mouth.
Ooh, that could be it. I would think the wheelchair would be more, we'd be able to see more of it, but that's a good observation otherwise.
I've seen those.
Yeah, yep, for sure. So that recovery coach is somebody that's going to follow the patient, checking in every 2 to 3 weeks, and is able to provide updates on their progress, but also maintain motivation and troubleshoot or change out any games that might be necessary. Okay. All right. So with that progress report, they are able to collect the data on what your movements are within the system. So if we have a wrist on the Motus hand, we're able to detect that movement, the ankle with the foot. So measures taken on active range of motion, passive range of motion, the flexion strength, and then the consistency of the use. Number of days over 20 minutes is what it's calculated as. So it's more or less a way for patients to maintain that accountability and that consistency with their recovery and their focused neuro recovery at home. All right. So we'll go through this one, and then we'll look into what kind of all these things are. So We run everything through insurance, okay? We are covered by Medicare and most private insurance plans. You can see some of these emblems: Blue Cross Blue Shield, Medicare, United Healthcare, Cigna, Humana. Every insurance has some different intricacies within it. So we submit for insurance, and then if we have coverage with insurance, we oftentimes there's a copay. If somebody has a secondary insurance, most times that is picking up the leftover bill with the copay. If we have a copay that we can't afford, okay, because this is billed as DME, okay, Motus Nova is able to reduce or waive completely collection of those copays, okay? So the big mission overall for Motus Nova is to make neuro recovery as accessible as possible for patients. Now, this means that if we are covered by insurance, we might not have to pay anything additionally for those copays. And it certainly just depends on everybody's situation with how much they can pay or are able to pay. Okay, so I don't want you to be worried about any copays whatsoever, because we're not allowing that to be a barrier. All right. The other thing is, if we submit for insurance and insurance denies completely, we have a 60-day free trial that we are able to send this out to a patient. They're able to use the device for 60 days, and then we ship it back. Okay. So prepaid shipping to you, prepaid shipping back, essentially at no cost for use for those 60 days. And that's available for patients that do not have that insurance coverage. Okay.
How are your patients evaluated? They go to the, how do you know if you need this? Okay. Some of us
Yeah.
maybe. Mm-hmm.
So good question. Many times what I am doing is talking with therapy groups, okay? You guys are part of a support group, so it makes the situation just a little bit different than the general therapy group. With the therapy group, I'm talking to therapists, and then they are discussing with their patients. And what I do is many times I'm scheduling a time to come see the patient and try this out with the patient. Okay.
Mm-hmm.
For you guys, that can be something that that we can figure out, or you can reach out to me directly to set up a time to try this out. Okay. Now, this means that we can either meet at your clinic that you go to if you're going to therapy now. I live in just north of St. Paul in Vadnais Heights. So I'm essentially in town in Minneapolis, St. Paul. So I am able to go to people's houses if we needed to, okay, to try this out. I've done it before. So we like to make some of those instances as easy as possible for patients to try this out. Okay.
Are you in Maryland? I'm in Maryland.
You're in Maryland?
Yes.
Very good. So we do have clinical specialists all around the country now, or soon will be. Maryland is a location where I could get you connected with the local clinical specialist there.
Okay, thank you.
Yeah, so certainly reach out to me, and I can get you and your information to them, and they can reach out to you as well. I can't think of the name off the top of my head. There's a bunch of us, of course. So, but Maryland and the East Coast has been kind of where the Motus Nova's initial kind of population. If we look at this map, of course, on the East Coast, everything being more populated, so there's more people, but also stretching out to the West Coast and in the middle states, we're growing. If we look, if we could zoom in on Minnesota, there's going to be a lot more because I've been doing kind of this outreach and working with patients, but this just being a map to show a lot of that widespread.